Traumatic brain injury is an event which disturbs our roles, responsibilities, and relationships that were established prior to the injury.
There is a gap in healthcare in understanding how gender affects recovery.
Gender plays extremely important role in people's ability to fulfill or adapt to life in their environment after the injury.
People have expectations of what they can do pre-injury, and they think they can do those things after injury. And so if those expectations are not met, that's where a lot of the psychological stress comes into play.
We have to focus not only on physical or cognitive abilities or inabilities, but we have to address people's functioning in family and society.
So a lot of our work was to understand the knowledge and needs of persons with traumatic brain injury, caregivers, as well as clinicians and healthcare providers, to build tools to understand how sex and gender influences recovery. Oftentimes, participants, when they're describing their experiences, they talk about their gender, but they don't realize that that's what they're talking about.
In one of the stories that I heard, it involved a man and a woman who were married for some time, and the man had actually sustained a traumatic brain injury. He had expectations that he could use his power tools, cut the grass, and do these tasks that lined up with the expectations of what he thought it meant to be a man. And in this case, those roles were actually disturbed. So he either had to stop them, or some of those tasks were transferred to his partner.
You realize that gender does matter within the recovery. It matters with how an individual's identity changes and their roles and behaviors change after the injury. So it's very important to be incorporated within the healthcare systems and for clinicians to be aware that gender influences a person's recovery, but also for awareness for the individual with traumatic brain injury to understand that it's really part of the process to adapt to perhaps new identities and new roles after injury.
So one of the limitations of the study is that we only had those who identified as men and women take part, but hopefully in future studies, we can have those with different identities, non-binary, and other dimensions of diversity also take part in the study for even greater coverage.
So this work really laid the foundation for creating educational materials for persons with traumatic brain injury and their caregivers, as well as clinicians, and potentially looking at ways to incorporate these educational materials during recovery.
What's really exciting about this work is that it speaks directly to issues of equity, diversity, and inclusion. And what that means is that we aim to make sure no one is left behind, and hopefully that will improve healthcare for all.